Fourth and final part of chapter 19, and this one's on capillary exchange. So the velocity of the flow changes as blood travels through systemic circulation. It's going to be fastest in the aorta, slowest in the capillaries, and then it actually increases again in speed in the veins. Speed is inversely related to the total cross-sectional area, and capillaries have the largest area, so they have the slowest flow. And slow capillary flow is actually good because it allows time for exchange between the blood and tissues. And so this is just showing the cross-sectional area of different vessels. So we have arteries, which is small, and then capillaries, which you can see as we branch, we keep branching, and we get to capillaries, and we have a lot of cross-sectional area here. And if we correspond it to the graph down here, we can see the speed in the arteries is pretty fast, and it's getting slower and slower. And then it gets really slow in the capillaries, and then it goes back up in the veins. Vasomotion is intermittent flow of blood through capillaries, and this is just due to the on and off closing and opening of precapillary sphincters. Remember those little cuffs of smooth muscle we talked about that clamp down and make it to where they act like valves? Many molecules pass by diffusion between blood and interstitial fluid. They're going to move down their concentration gradients, and molecules use 4 different routes to cross capillaries. They either go directly through endothelial membranes. This would be lipid-soluble molecules like respiratory gases, for example, oxygen, carbon dioxide. They can pass through the clefts. This would be like water-soluble solutes. They can pass through fenestrations, also water-soluble solutes, and then active transport through pinocytotic vessels or caveoli. And this would be larger molecules such as proteins. And so this is just showing a capillary, and then there's a nice little square here, and we're about to blow this square up. And we have direct diffusion, which would be a lipid-soluble substances, movement through the intercellular clefts, water-soluble, movement through the fenestrations, water-soluble, and then movement through these vesicles would be larger substances like proteins. So fluid is forced out clefts of capillaries at arterial end, and most of it returns to the blood at the venous end. Bulk fluid flow across capillary walls causes a continuous mixing of fluids between the plasma and the interstitial fluid, which is going to maintain the interstitial environment. Now, the direction and the amount of fluid flow depends on 2 opposing forces, and one is hydrostatic pressures, and the other one is colloid osmotic pressures. And with hydrostatic pressure, this is just the force that's exerted by a fluid pressing against a wall. And there are 2 types. We have capillary hydrostatic pressure. This is the capillary blood pressure that tends to force fluid through the capillary walls. It's going to be greater at the arterial end than it's going to be at the venual end. And then there's interstitial fluid hydrostatic pressure. And this is going to be the pressure pushing the fluid back into the vessel, usually assumed to be 0 because lymphatic vessels drain interstitial fluid. And then there's the colloid osmotic pressures. We have capillary colloid osmotic pressure. This is the sucking pressure created by non-diffusible plasma proteins that are going to pull water back into the capillary. So this is going to be about 26 millimeters of mercury. Interstitial fluid colloid osmotic pressure. This is inconsequential because interstitial fluid has a very low protein content. So usually it's only about 1 millimeter mercury. I'm about to sneeze. Excuse me. All right. So when we're trying to figure out the interactions, we need to look at all forces that are acting on the capillary bed, and we come up with net filtration pressure. And this is calculated by taking the hydrostatic pressure of the capillaries and adding the osmotic pressure of the interstitial fluid and subtracting the hydrostatic pressure of the interstitial fluid plus the osmotic pressure of the capillaries. Net fluid flow out of the arterial end is filtration, and fluid in at the venous end is reabsorption. More fluid leaves at the arterial end than is returned at the venous end, and then excess interstitial fluid is returned back via the lymphatic system. I'm not going to ask you to work out a problem on this, but I did want you to look at this diagram just kind of quickly. I'm going to blow this up. This is just showing 20 liters of fluid is filtered out per day. And as fluid is going through here, it's getting pushed out. When it gets back towards the side, it's going to be sucked back in. So 20 liters of fluid is filtered out, 17 is reabsorbed, and about 3 liters is going to be picked back up by the lymphatic system. And I'm not going to ask you to work out a problem on this, okay? But to calculate this, you would look at capillary hydrostatic pressure plus osmotic pressure of the interstitial fluid, which is 1. So 35 plus 1 is 36. I know this says 35, 1, and 1. There's a problem with this diagram. I don't exactly know what happened, but that should say plus 1 right there where my little hand is. And then we have osmotic pressure of the capillary at 26, hydrostatic pressure of the interstitial fluid at 0. So this is going to be 36, and this is supposed to be a minus. Minus 26 is going to give us 10 mmHg net outward pressure. So more is going to end up being pushed out than come back in. Here are your questions. That's all I've got for you. That's all I got for chapter 19.